So, good morning, good afternoon, and good evening, friends, wherever you are. Today, the topic that I have chosen is art of listening, and this is something that every doctor should have mastered it because I know it so clearly that whenever a patient goes to see a doctor, he wants doctor to listen very carefully, listen properly. So I find that this is a very important quality of a doctor to listen to his patient very well. This is something that I have also developed very nicely over the years, as I understood that this is the first step of healing, because the most important thing is to listen and listen to patient. It is very important because a patient has something to say, a story, his where is the pain, what happened in his life, what medication he has taken, how exactly this has started. There's a complete story and that needs to be told, and a doctor should listen to it carefully. So those of you who are tuning in today right now, do write in the chat section if you have met such a doctor who listens to you very well and gives you enough time, and you feel very satisfied that he really heard me out properly. A doctor should not just listen to the words of the patients, but also listen to the things or the words that are not told. This is very important because there's so much happening in a person's life. First time when a patient comes, I spend almost half an hour to 45 minutes just listening to the patient. I keep asking all kinds of questions. What else have you forgotten? Do you want to say anything else? What else happened? Anything happened in your life before this happened? Because I want to know everything about the patient, not just about the disease and the ways the pain and what medication is taken, because our holistic medicine consultation tells us to know everything about the patient, and a doctor should provide a very safe space, a very trusting environment, because I always say that you do not hide from God and you should not hide anything from your doctor. Your doctor has to know all about you. I understand that when you meet me first time, maybe you don't want to tell everything because you do not know who is this doctor. Maybe you got some reference and then you decided to come. So it's like a first time we are meeting each other, we are learning, we are developing that trust, that bond, and it's possible that you may not tell me everything the first time. Then there is a possibility that maybe you're going to tell me in the next meeting or the meeting after. I usually sense that a patient is saying the truth or not saying, or saying the half truth, but I don't pressurize, or I do not insist that they tell me, because honestly speaking, after many years of seeing thousands of patients in last 37 years, I have learned this art of listening even to the stories which are not yet told, which are still hidden, which are secret, and I'm just listening. I'm paying attention to the facial expression. I'm paying attention to the way they walk into my room, or someone is speaking very softly, someone is very loud, someone is very quiet, just doesn't speak, doesn't want to tell me anything, just tell me a few things and then just keep quiet, thinking, doctor, you fix me. You tell me what I should be doing. Sure, I understand. I will. I don't force my patients, but I still give them a lot of space and time, because it's really the first connection that a doctor establishes with his patient, gives a very good information. And then I usually suggest a plan, and I explain things properly as to what I have understood about your condition and what is my experience so far, and how we can help you one step at a time. There is no shortcut to healing, there is no fast method, because we just need to do it, one step at a time. So I explain it very clearly. I also explain to them that I am still getting to know you. Maybe it's going to take me a few more weeks to learn more about you. Maybe you've forgotten something. So all this takes time, and more you share, better it gets. This is what I tell. So this is how I want to explain. And so very important that sometimes they reveal me the deepest, secrets of their life, this, where they are crying or they are very sad, or some very tragic, experiences, that have happened in their life. Like just last week I had a patient who probably has gone through tremendous trauma in his life, and he was very reserved, very concerned. I said, all right, we'll not talk about anything at all that has happened in the past. We'll not open those bags. I'll make you feel comfortable, and let's just get on to healing you properly. And this is what I do, because only if they are feeling comfortable, and only if they want to, only if they wish to, then only I help them, not otherwise. I don't want to touch those sensitive areas. And the most important thing for a patient is to trust. I understand that it doesn't happen overnight, but wait, as you experience the healing power of the remedies, you establish this trust, and maybe then you want to reveal. And very important for a doctor to be having a very empathy, a lot of empathy for the patient. The patient has gone through, and I have to listen in a very non-judgmental way. I should not be judging the patient, because when you judge, then you put a curtain, and then you don't help the patient at all. So it's very important to listen to the patient with a very clean slate, completely unconditional, without any judgment, just listening. In these days and time, I find that doctors don't have time. They don't remember names of their patient. They probably don't remember history. They don't remember what has happened. They are mostly tied to various gadgets, and they are busy, entering data. They are mostly interested in your blood test, and they are probably also using some machines, to test you. So the real connection does not happen always. The real connection with a patient happens at the heart level. And so that is very important. This is something that I would like to explain, that a, a doctor that makes you laugh at the end of the consultation, makes your half the pain go away, half of your troubles go away. You feel already healed. When you come, you sit, you express, you share, and you feel that you were heard to properly. And then you are suggested a solution. You establish a nice rapport, a link, a bonding with your doctor. So this is the way forward. This is how I would like to listen to my patient. And this is what a doctor's quality is, to really listen to the patient, give time. When I give really a good time in the first interview, then second and third, and maybe after that there's not much, because I've already established a rapport. And then it is just checking a few things and finer details, and if anything that is missed. And that helps, to make the diagnosis and also select the remedy properly. So, the art of listening and a doctor patient relationship is extremely important part of healing. It's not just the medicines, it's just not those therapies. It's also a doctor listening to the patient well,